Hello guys, welcome back to US Healthcare Academy. Today I am going to take you through how the vitals data is actually saved in the backend. So how it looks in the table format like this. And before we jump into it, I just want to say that yesterday, when we were looking into all the different clinical sections like encounters, vitals, procedures, diagnosis, there's one section that I missed, guys, and that is immunization. And immunization is all the vaccines that are given when the child is born or for any kind of flu. All the vaccinations that are given is called as immunization, like a pneumococcal vaccine example. And those vaccines or immunization is represented by CVX code. All right, so let's jump right into how vitals data would look in the backend database system. So first of all, any data or any table in the backend system will have a auto-generated unique ID which will represent each and every row, and that's the reason we have vitals ID here. Now this record belongs to which patient, and hence it is linked by the patient ID. So 7890 is nothing but it's a unique ID for one patient, and all that patient's information can be linked back to the patient table using this ID. Encounter ID is the unique identifier for the encounter. So guys, you remember, right? All this information like vitals, medication, diagnosis, procedure is ultimately done on an encounter. So, so each and every record in the vitals will have the encounter ID so that it can be linked back to that encounter. A date is the date when this vitals were captured. Time is obviously the time when it was captured. Now comes the important part. So, line code. This is the most important thing, guys, that you need to understand. See, now this record is for blood pressure. So it shows the blood pressure of the patient, and this line code is specifically used for blood pressure. So which is 85353-1, which says this record is for blood pressure. Now what is the measurement value? So guys, remember there are different ways of storing the measurement value. Now in some systems, how it will be stored is it will also have like the diastolic pressure and systolic, and instead of this 120 by 80 we will have 120 on a separate line and 80 on a separate line. So this is how a blood pressure is recorded. The unit of measure in which what is the unit of measure for this measurement value? So 120 by 80 mmHg. This is the unit of measure. Reference values. So reference values means what is the normal values that blood pressure has basically. So 60 to 80 is the low range, which is diastolic. And interpretation of this measurement. So patient's blood pressure is 120 by 80, which means it is normal. And then there can be several other fields, guys. But for this example, I've taken location. So the exam room, which this, where these vitals were measured and by whom it was measured, Dr. Smith. So in similar way, if you see the second line, now I'm not going to repeat visit ID, patient ID, encounter ID, date and time. We'll just go through this line codes. So 8867-4, which means heart rate, and the measurement value is 70. The unit of measure is BPM. What is the reference range? It is 60 to 100, so it is normal. Now remember, guys, just imagine when a doctor is recording all this, obviously doctor won't remember all the line codes, right? Because impossible to remember so many codes. There are like millions of them, including diagnosis, procedures, nomad, lawing. So obviously it's not possible to remember all this, right? But what's possible is to remember the description. So in the UI, in the user interface, these codes are not shown. For the sake of user, to make it user friendly, in the drop downs or something, this values will be there, which doctor will just have to select, and then automatically this code is linked to this value. So this code is something that will be saved in the backend. All right. So similarly, this is code for respiratory rate, code for body temperature, code for oxygen saturation, height, weight, BMI, pain level. So guys, I just wanted to show you how the data is saved in the backend. The reason being because in future when we are going to do videos on extracting the data, transforming it, and loading it into a system and using it for different use cases, like to calculate, to compute the measures. Now let's not get into what measures are and everything, because that is altogether a separate topic, a separate expertise. So there will be a series on that. But before we before we go there, I just want to make sure that I set the foundation correct, and we have the correct foundation so that it's easier for you to understand and grasp it. So hope this helps, guys. There will be similar videos on other sections as well, so stay tuned for that. Till then, take care. Bye bye.